Greetings to the Ackerson Stevens crew. We're going to cover your 2025 employee benefits. We've got a benefit guide prepared that's really your roadmap for everything under your benefits. Let's jump in. Susan's put this together. We've got a great table of contents. Some of these items are pretty boilerplate, but some of the things we want to mention here are you can make changes after you enroll if you have a qualifying event. So what's that? Marriage, birth, death, adoption, divorce, something like that. If you turn eligible for Medicare or something like that. Otherwise, your elections are for the full year. And dependent children can be covered up to 26 years old. Got a new hire waiting period of 60 days. All right. Here are the contacts. We're real excited this year to bring you a plan. You're not going to change networks. It's Cigna, but we're excited to bring it to you under Gravy. They're our administrator. Gravy are the folks that handle the claims and the money. The pharmacy manager will be CVS Caremark. Doesn't mean you can't go to another pharmacy. It's just being managed by CVS Caremark. We're not changing our dental plan. And we're not changing our wellness plan. It's saved a lot of money for a lot of people in their paychecks. All right, this is what we're excited about. The summary of benefits here shows that in a typical year, you'll go see your doctor, maybe go to urgent care, maybe get a prescription for a cold or poison ivy or an earache. Those kind of things are all going to be done at $0. Office visits, both specialist and primary, urgent care, $0. Even outpatient surgeries, and of course, generic meds, $0 here. So how would you you have a $0 deductible. So how would you hit your out-of-pocket maximum of $3,000? The only way you're going to do that is here, with a facility-based claims. All these other events or examples are $0. We're in the Cigna network, so that you're not changing anything you have now. They've got, of course, a teledoc feature, and this is pretty cool. If you have any musculoskeletal pain, they've got virtual physical therapy. That's also $0. So my point in saying all that is that in a routine year, 95% of us are not going to have any out-of-pocket costs. They've got an app. Your app will be downloaded when you get your card from the QR code on the back of your card. And you can also use that QR code at the doctor's office. You give that to your doctor's office, they're going to get everything they need. Or they can call the number on the back of the card. You can get your ID card through the app. You can track your claims. But if you have any questions, let's put this phone number in our phone right now. 866-863-6232. That is your one-stop shop for your medical. As I mentioned, our dental's not changing. We don't have a deductible, and we've got a very rich benefit. It'll cover up to $2,000 every year. Get your teeth cleaned every 6 months. That's twice a year. And this thing pays for itself. Premiums are only $8 a paycheck. If you have anything serious done, fillings or crowns, things like that, it'll cover it at a certain percentage. Fillings at 80%, crowns at 60%, up to this $2,000. We've got a vision plan. It's very affordable, $1.56 a paycheck down here. And get an eye exam. If you're over 35 years old, get an eye exam. Partner of mine had an exam and found out he had early cataracts. When would you want to know that? Your employer pays for $10,000 worth of life insurance, which is enough to get you in the ground. And this we added last year. It's been terrific for saving people money. I don't know if you've used it yet or not. There's some really cool wellness tools here. I'll point out a couple. this expert second opinion. Everybody should get a second opinion. We've got sleep disorder help, sleep improvement right down here. Of course, mental health counseling with no limits. Everybody needs to talk to somebody occasionally. They can help you set appointments with specialists. Really anything that you need in the way of improving your lifestyle, diabetes care, or substance abuse, weight loss, smoking cessation. All you're asked to do is a health risk assessment. And once you do that, you qualify for these savings. And most of you are already seeing it in your check. There's 3 line items: the program fee that comes out, the money that comes back, the small fee that's retained. Your net increase in your pay is averaging about $125 a month across the group. If you're not participating in this, you need to be doing it. Once you complete this health risk assessment down here, it's about 10 minutes. You qualify for the plan and you start enjoying these benefits in your paycheck. Okay, that's it. We hope you all have a very healthy year. Take a look at this benefit guide, read it top to bottom. It's got lots of great information. Of course, we have voluntary benefits for those of you who have a family history of heart disease or any type of cancer. The accident insurance, I own it. It's $4 a week, and I've used it multiple times. So if you have any questions about that, you can contact Susan in our office. All right, folks, we wish you a really healthy year. And that's it. All right, take care. Bye now.